So we had an interesting call the other day. It was diabetic. Blood sugar was less than, read low on our glucometer, which means that the sugar is less than
20.
Great. And, which, okay, happens. Diabetic, history of diabetes. Okay, so we start an IV on her. We give her D10, which I do like. I'm really liking the D10. I didn't think I would necessarily care one way or the other.
Yeah.
Excuse me. But I really like the D10 over the D50.
Yeah. Well, because one of the things we used to do is, well, we still do it, obviously, is when someone's blood sugar is really low, we'll just give them sugar straight through the vein.
Right.
And we used to give it in a much thicker mix, you could say.
Yeah, it was 25 grams of sugar and 50 cc's of fluid.
Yeah.
And so now it's 25 grams of sugar and 500 cc's of fluid.
Yeah.
Which one of the problems with the stronger concentration is that was really harsh on the veins.
Yeah, and if you happen to miss the IV or the vein blew,
right,
getting that into the surrounding tissue.
And you didn't realize it.
Yeah, getting that into the surrounding tissue, bad story.
So we're giving her D10 and we're talking to family. So what made this call interesting is she doesn't take insulin.
What?
Well, yeah, she only takes normal medication. How did her sugar get so low? I mean, generally when we see blood sugars low, especially that low.
It's on insulin-dependent patients.
On insulin-dependent patients. So she's not sure why her doctor started her on the oral medication 3 days previous to this. But she just hasn't been feeling right ever since she started taking it.
Okay.
So what's been happening over the last 3 days is that the medication has been pushing her sugar lower and lower and lower, slower over time.
It's like limbo, but with sugar. How low can you go?
Exactly. So yeah, we had to give her D50 to get her up to a normal range. Now, normally D10, sorry. Normally, I don't advocate taking diabetics to the hospital once we wake them up unless there's another specific reason. Because it's not going to do them any good. All they're going to do with them at the hospital is watch them for a couple of hours and make sure they eat. Yeah.
Yeah, they're going to make them a sandwich. And that is the most expensive BLT you will ever get.
And not worth the money.
Yeah, probably not.
So,
$1,000 BLT.
At least, So, I don't normally advocate them going to the hospital, but on this occasion, I was like, yeah, we should probably go. Because the reasoning, we need to get that medication adjusted or have you taken off of it or something. And so we gave her like 150 cc's. She woke up, she started talking to us, and we dialed back the sugar. So we didn't rocket it through the roof.
Right.
So I check it in the truck, still less than 60. So I turned up the flow a little bit, and I'm like, well, get her to the hospital. She's had all 500 cc's, and she's only at 82.
Wow.
Yeah.
Boy, that is.
So I think she has a lot of that that medication floating around in her system, just ready to do its job.
Yeah.
And
boy, did it.
So yeah, that was just it's just kind of an interesting take on diabetes. Where after so long of doing it, where you're like, okay, well, how much insulin do you take? I don't take insulin.
Huh.
No, seriously, how much insulin? Stop messing with me. How much insulin do you take?
That's pretty funny, man, but really.
Yeah, exactly. This is an emergency situation, man.
Yeah, clearly not time for joking.
Exactly.
Because we don't.
No, never.
Yeah.
So welcome to Medical Stuff. My name is Mark, the Sugars Frankham, and that is Chris. Does my breath smell fruity, Finkston?
I always love the nicknames. I am 90% certain you're making them up as you say them.
Usually, yeah.
Yeah.
Chris never knows what the names are going to be beforehand.
Which why when we did the STD episode, I was really curious. I'm like, God, what's going to come out of this one? Like that's...
Very rarely is it ever anything positive.
I believe my name became Chris, is this drip normal Finkston? I'm fairly certain that's what you said.
Probably pretty close.
Yeah, that sounds about right.
Well, it's Mark Burns when I pee Frankham.
Yeah, that's. Oh no, I'm not saying that you're not unfair about this. I feel you are very, very even keel. So
this evening we're going to be talking about
the sugars.
The sugars, diabetes. So in some parts of the country, that's how it's referred to.
The sugars
is the sugars.
Yeah, it's got a lot of nicknames.
So what do you know about the sugars, Chris?
Well, a little bit.
Just a little bit.
Well, I know enough to do about an hour-long episode of a podcast.
I really know just enough to do damage on scene.
On the sugar, right. So diabetes is a disease that impacts your metabolism. And your metabolism is basically, that's just how your body processes nutrients and the fuels that it has. And so what diabetes does is it impacts the way that your body specifically impacts the way your body handles sugar. And so what happens is that your body is normally able to produce a chemical called insulin. And insulin is used to help sugar make its way into the cells of your body to be used as fuel.
Well, it's kind of the gatekeeper.
It is.
The sugar molecule is too big to get into the cell by itself. So your body produces the insulin to open the door and allow the sugar into the cell to be used.
Yeah. And so if you don't have this insulin to do the job, what you end up with is you end up with a lot of free-floating sugar in the bloodstream. And that's why diabetics have high blood sugars.
It's like free-floating, you know?
It's like the Cheech and Chong of the bloodstream.
And you can affect the sugars by getting high and getting the munchies.
Yeah, you can. That's
not advocating.
That is not a hypoglycemic treatment. We'll talk about hypoglycemia a little bit because that's kind of the opposite of diabetes. But please don't take that advice. I think we should probably start reiterating on a regular basis that this is not an advice show.
We're not. We're not trained doctors.
Oh, we're not. We're barely trained paramedics. So diabetes, though, this is a good topic to talk about because it's one of the most prevalent diseases in the United States. Estimates range anywhere from about 8 to 10% of the total population having the disease. The CDC estimates that 12% of the adult population has it, with about a quarter of the population not even knowing that they have it.
It's just bad doctoring, though, if you don't know you have diabetes.
Quite frankly, maybe you should go see a doctor. I imagine that's probably it, too, because if you think about it, diabetes, especially as we talk about diabetes that onset later on in life, that can happen in your 20s and 30s. And I'm in my 30s now, Mark, and I don't really regularly see a doctor until something's wrong.
Right.
You know, I don't.
Well, and the thing is that this is if it's the one that, oh, good Lord, I give up.
And we're done. That's medical stuff. You can find us on.
So, I mean, if it's later onset in life, this is something that's going to happen over a long period of time. So you feeling a little bit weird because of the change in your blood sugar levels slowly over a period of time can make it seem normal. Oh, I'm just getting older.
Right.
Until it gets to the point where you're having to go to the emergency room because something very critical is going on and you think, well, I never knew that was a problem.
Yeah. And so I think that's probably why you get so many people not even knowing they have it. So diabetes can actually cause, because of the fact that you end up with a lot of sugar free floating through your bloodstream, it can impact a lot of different organ systems. Basically, if your blood touches it, diabetes has the ability to impact it, although there are some more pronounced ways that it impacts other organ systems, such as the kidneys, that we'll talk about a little bit later.
People with diabetes can live a normal life and often do. A lot of people out there, if you treat it right and you treat it with respect, you can live a very long, productive life without any huge side effects for many, many decades.
Right.
So today we're going to be focusing on diabetes mellitus, which is the most common. There are other types of diabetes as well. The most common, the three main types are going to be type 1, which used to be called juvenile onset diabetes. Type 2, which used to be called adult onset, which we kind of touched on a few minutes ago. And then gestational diabetes.
And gestational diabetes, that comes on during pregnancy.
Right.
Yeah. Never mind. I was going to say, I almost said that comes on during pregnancy for women.
Somebody's been watching too many Arnold Schwarzenegger movies.
Right.
Because apparently he thinks that men can get pregnant.
Right.
Yes. Well, so this is a disease that impacts your body's ability to use glucose, like we touched on. It refers to a group of diseases that, well, okay, so glucose is vital to your health because it's important for the energy source for the cells. So anything in your body, including your brain uses a lot of sugar. So when you eat something, your body breaks it down into micronutrients, and a majority of the energy is going to be coming from the sugar that it produces in your gastrointestinal system. That then transfers into your bloodstream and goes about your body, powering everything.
Yeah.
And so if you affect the way your body can interact with that, that creates huge problems.
Right. So the underlying cause of diabetes, it's going to vary by type, but no matter what type of diabetes you have, it typically leads to an excess of sugar in your blood. In fact, that's one of the main ways that it's diagnosed is by measuring the level of sugar that's in your blood. And diabetics will be typically check their blood sugar. It's a lifelong habit that they get into. And they just have these little home kits just called glucometers that we have in the ambulance as well that they use.
My mom has one that plugs into her iPhone.
Oh, that's cool.
Yeah, it's got a little container that has her Lancets in it. It has the dongle, and it has a test strips in it.
Mm-hmm.
And the thing's maybe the size, probably a little bit shorter than a pack of gum.
Oh, wow.
Like the thin packs of gum has like 8 or 10.
Yeah.
It's not much smaller than that.
Is it 8 mark or is it 10?
Yes. Anyway, so yeah, it's a pretty cool little thing. It's very accurate. Uploads to an app, and then she can export information from it to her doctor.
That's awesome.
Yeah.
I love that.
So type 1 diabetes, your own immune system attacks insulin-producing cells in your pancreas, destroying your body's ability to make insulin. This is type 1. With type 1 diabetes, you must take insulin to live. There's just no way around it. Now, just because you're taking insulin doesn't mean you have type 1. It's just that most of your oral medications that you take for diabetes for type 2 diabetics basically make your pancreas work better, or your cells burn more efficiently the sugar that you have. So type 1 diabetics have to take insulin because their body cannot produce it. They also have to do carbohydrate, fat, and protein counting. These are going to do frequent blood sugar monitoring. These are the people who check their blood sugar before they eat, or at least a couple times a day, or at least they should be doing it that way, because they have found over the years the best long-term way to treat your diabetes is to be as close to a normal blood sugar all the time as you possibly can. And if you get too high of a range, or you keep having too high of a fluctuation of the ranges of your blood sugar, it actually does long-term damage. One we touched on earlier and we'll get to later is the damage to the renal system, which is just the kidneys and not the liver. And yes, I know that. Leave me alone. Do you have something to say?
No.
You sure? Look like
technically it's not just the kidneys. It's the kidneys, ureters, bladder, and urethra. But
for the sake of this conversation, we're talking about the kidneys.
By the way, if you want to learn more about the renal system,
we do have a renal system podcast, which is much more informative than this, and Chris is less mean.
Yeah. Yeah.
So
I don't get to be right very often. And really. So when I am, man, I capitalize
really
on that.
Own it.
Yeah.
You're going to be eating more healthy foods and exercising regularly, maintaining a healthy weight. So type 2, also known as type 2 diabetes, is a long-term metabolic disorder that's characterized by high blood sugar, insulin resistance, and relative lack of insulin. So managing type 2 includes healthy eating, regular exercise, maybe an oral medication, which some of your normal ones are going to be glucophage.
Yep.
What else?
Metformin.
There you go. Glyperamide. So, good.
No, keep going.
Okay. Stop breathing in the mic then.
Sorry.
And then you may be taking insulin, and then you should be doing glucose monitoring. Now, one thing I have found with type 2 diabetics who take their oral insulin, they're horrible about checking their blood sugar on a regular basis. And when I say regular basis, I mean sometime in between they have doctor visits. Right.
And that can be, it can be lethal.
Yeah.
And it can go both ways. And we'll talk a little bit in a little bit and why, Mark and I earlier, like we opened up with a story about a diabetic with low blood sugar, which what we've been describing to you is that diabetes causes a high blood sugar. Mm-hmm. Well, the medications you take can sometimes drive it too far the other way. And we'll get into that in a little bit because that's actually a very common diabetic call that would go on.
So gestational diabetes mellitus, or GDM to those in the know, is defined as any degree of glucose intolerance with the onset or first recognition during pregnancy. Now, this definition applies whether insulin or only diet modifications used for treatment. So you can be a gestational diabetic and do nothing but get good exercise and eat properly. But your dietitian is going to recommend total daily calorie counting, usually about 22 to 2,500 calories per day for a normal woman of average weight. If you're overweight, you may need to lower that to about 1,800 calories per day, which really, in this society, not a whole lot.
Yeah,
you can hit that.
That's a large fry. Like that's.
It's not that bad.
I know.
It's just close though.
Yeah.
You can if you're having 1,800 calorie a day diet and you go to McDonald's and get a regular like Big Mac meal with a Coke, Yeah, that's pretty much the only thing major you're going to eat the whole day.
That's, yeah. Other than that,
And with a large Coke, it may actually be, you may be over your limit.
Yeah.
But on top of just calories, they're going to want 10 to 20% of your calories to come from protein sources like meats, cheeses, eggs, seafood, and legumes. Although it depends on the seafood because a lot of pregnant women are told not to eat seafood.
Oh, you know what I learned about legumes?
Legumes.
The qualifications for a legume.
Legumes.
It's any nut that you eat.
Yeah, do you know where you learned that?
From you. Because I thought it was like just peanuts.
2 words, renal system.
And then Mark pointed out that is like a whole class of things and that it would be pretty stupid if it was like a class of nuts that just included peanuts.
Right, yeah.
Otherwise, you just call them peanuts.
Right.
Not legumes.
Which brings me to why I hate pickles. The name pickles.
Oh, I'm with you on this because I know where you're going.
You can pickle just about anything.
Why is it that cucumbers get the title?
Why are they so hoity-toity that they can take? But when you call America, America,
That's true.
kind of doing the same thing.
Yeah, because technically Canada's in America.
Mexico's in America.
Yeah.
It's Central America.
Yeah.
So, my daughter,
Yeah.
Native American.
Okay.
So she did a test, a DNA test, and it said Central/North American, right? And I think the problem with DNA testing sites is that it depends on the base that they have to work off of. So to find out your European ancestry, yeah, they got a lot of data to go off on that one.
Right.
Native Americans, not so much. Central Americans, not so much. So I just told her whenever she applies for college applications, she just needs to change it to Native Central American. Because it didn't give a good specific answer on that one. So 10 to 20% of your calories from protein sources, meats, legumes, stuff like that. 30% of your calories from fats. 10% of your fat calories from saturated fats. And the remaining 40% or so of your calories from carbohydrates like bread, cereals, pastas, rice, fruits, and vegetables. So that's how they're really going to want to break down your diet if you're a gestational diabetic.
Break it down.
Break it down.
So how do you get tested for diabetes? How does someone know they have diabetes? Well, there's a few different ways. One of the common tests, though, is what they call the glycated hemoglobin test or the A1C test. I'm going to be fully transparent here. I've always known about the A1C test. Just now learned that it's called the glycated hemoglobin test. So this is a blood test that indicates your average blood sugar level for the past 2 or 3 months. It measures the percentage of blood sugar attached to the oxygen-carrying protein in the red blood cell. It's called hemoglobin. And the higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests is indicative of diabetes.
So now if the A1C test isn't available, or there are certain conditions that can make the test inaccurate, such as pregnancy, which we'll touch later, or uncommon form of hemoglobin, a hemoglobin variant. So I'm assuming in this we're talking like maybe sickle cell,
Okay.
Something along those lines. Your doctor may use these other tests. One's called a random blood sugar test, which just walk up to people in the street and check their blood sugar and come back. Just, excuse me, can you check your blood sugar? And they come back, Mr. Frankston, I'm sorry, but you have diabetes.
We just randomly checked 5 people, and 4 out of those 5 people, Spencer was the one that didn't. 4 out of those 5 people.
Always got to have that outlier,
If you guys want to know more about that joke, you can check out our Medical Myths 1, where Spencer Oliver was a guest. And we talked about 3 out of 4 scientists or 3 out of 4 dentists.
We'll never be a guest again.
Yeah, probably not.
I think he's been banned from the show. No, we love you, Spencer.
Come back.
And we miss you.
You can replace Mark.
Or Chris, anytime. No, crap. You have to replace me because Chris's house is where we record.
Yeah, see, that's the problem.
Man, location.
It's real estate, baby. I'm closer to his house, too.
Oh, that's a good point.
Yeah.
Yeah, but he's got family up in Vancouver. Boom. Anyway, random blood sugar test. A blood sugar sample will be taken at a random time and may be confirmed by repeated testing. Blood sugar values are expressed in milligrams per deciliter in America, and in Europe it's millimoles per liter. So these are dramatically different numbers.
Oh yeah, like they're not even close. For example, so regardless of when you last ate, if the random blood sugar level in the U.S. is 200 milligrams per deciliter, or 11.1 millimoles per liter,
Right.
or higher, that would suggest diabetes, especially when coupled with any of the signs and symptoms of diabetes, such as frequent urination or extreme thirst. Let's talk about that thirst for a second. So one of the
Our listeners have a thirst for knowledge.
Oh yes, and they have a thirst for this show.
And they're using this show to get it.
Drink up. Anyway, right. So this isn't like, oh man, I'm thirsty, got to get a glass of water.
No.
This is standing by the water cooler at work, glass after glass after glass.
Drinking from the spigot.
Yeah. That's a side effect of having too high level of blood sugar. What's trying to happen is your kidneys are working in overdrive mode to try and kick the blood sugar out of your system. And in such, you're losing fluid. So your body says, hey, I'm thirsty. We need to start replacing fluid. So you end up just drinking tons and tons of water, which is also the cause of the frequent urination. Your kidneys work in overdrive, got to pee it off.
So there are 3 big symptoms for diabetes. And in the medical field, you hear people sometimes talk about poly.
Gotcha. Damn it, Polly.
So you have polyuria, which is the urgent, you need to frequently urinate. And like Chris was talking about, your bloodstream has plenty of sugar.
Mm-hmm.
Your cells can't get it because your insulin is not working properly or your pancreas is not producing insulin the way it should be. So you have polydipsia, which is the increased thirst or fluid intake. And like we're talking about, this is not just I could go for a drink. Yeah, sure.
Yeah.
This is a driving need to drink fluids.
Mm-hmm.
One of the reasons you have the driving need to drink fluids is one of the ways your body will get rid of those excess sugars is to urinate them out. So you're getting dehydrated because you're peeing all the time. So you're drinking a ton of water to make up for that, to keep your kidneys floated so that they can process the sugar. And as a side note, while it's handling all this extra sugar, it's doing damage to your kidneys.
Oh, yeah. Big time damage.
Can end up leading to, if not treated over a long period of time, can end up for you going on dialysis.
Right.
So then the last one is polyphagia. So you have polyuria, needing to pee, polydipsia, needing to drink, and then polyphagia, which is the increased appetite. Because even though you have a ton of sugar in your bloodstream, your cells are still starving.
And they want more.
Right. Now, at the beginning of the show, Chris, what was your nickname?
Oh, why is my breath fruity? Something like that. Something about my breath being fruity or me being fruity. I don't know.
Why did we bring that up as one of our nicknames?
Because when you have an excess of blood sugar, one of the things you'll actually do is you'll end up breathing off something called ketones.
And it's not a band from the 50s.
Although it sounds like it certainly
really does, yeah.
Yeah. You end up breathing off something called ketones. And I'll let Mark go ahead and tell you exactly what ketones are. But these come out through your breath, and it has a fruity smell. Some people have actually likened it to, if you've ever smelt alcohol on someone's breath, some people have likened it to that. I personally wouldn't quite say it has that same kind of like, I don't know if you can say bite to it, but that it does smell a little bit like alcohol. But to me,
I can't smell it.
Oh, you can't?
No.
Oh, I can. I can. And to me, it's distinctly different from alcohol. Some people claim it's the same. To me, it's distinctly different.
Well, so what's happening is that your body is starving. The cells are starving. You can't get the sugar into the cells to feed them. Mm-hmm. So your body will start burning fat and muscle, which you can survive off for a while. But the problem is your body's geared towards using the sugars. Why? It's simply done. It's an easy process for the body to use it and move on. One of the byproducts of using the fat and the proteins to feed your body is you put off a higher level of waste product or acids. And so you start getting what's called diabetic ketoacidosis. These ketones start building up in your bloodstream, and you start to become acidotic. One of the main ways your body gets rid of acids, there's 3 systems for getting rid of your acids in your body to become more alkali. So one of them is you breathe them off. You breathe off the byproducts, and that's where the fruity smell comes from. And then another one is your renal system. Your liver will help balance that out. And then I just drew a blank on what the third one is.
Yeah. Well, the liver's not part of the renal system anyway.
I hate you. I hate you with... Never mind. Yes, you're actually right. So your body will metabolize that out through the liver, and then you'll have to pass off the stuff through the renal system into your urine, you jackass. So how bad do you think it has to get before your pee smells fruity?
I don't know, and I don't want to. I'm good not finding out because we kind of moved past that these days, and we have glucometers that'll test it for us.
When I first started out, we had chem strips.
Oh yeah,
yeah, those are.
Don't you have a good chem strip story where it's the highest blood sugar you've ever had on scene?
Yeah, we went to.
Well, your patient anyway.
Right. So chem strips were literally just this little strip you kept in a bottle. You put a drop of blood on there, on these two different pads that would turn two different colors. One turned to blue and one turned to beige or brown. And so we roll in on this call. This guy's down in the hallway. His ex-wife is there. They're still really good friends. She hadn't heard from him in a couple days, and so she decided to come by and check on him. His blood pressure is very low. We start an IV. We start giving him fluid. We check his blood sugar off the IV. So you would put 2 drops on the chem strip. Then you would, after a minute, you would dab the blood off, give it another minute, and you would compare the color, the shades of the blue and the beige versus a scale on the side of the bottle. And it gave you a range of where the blood sugar is. So it'd be between 80 and 120. It'd be between 120 and 160. Okay, so we drop the blood on there. Wait a minute, dab it off. It's black. Yeah. So I thought, must have a bad bottle of chem strips. I got a bad tester.
Yeah.
Hey man, run out and grab the other bottle of chem strips out of the truck because we kept it back up in the back of the rig. Partner goes running out there. His blood pressure is low. I start giving him fluids.
Your partner's blood pressure's low?
Yes.
Damn.
I know. He was stumbling all over the place. So we start giving the patient fluids. My partner comes back. We check his sugar. Comes back as black after 1 minute.
By the way, when you said that, all I could think of was AC/DC Back in Black.
There you go.
Yeah.
So we get him on the gurney. We start getting out of there. We're heading to the hospital. I explained to the physician on the radio what's going on with the patient. He tells me to give this guy as much fluid as I can get before we get to the hospital.
Oh, yeah.
By this time, we'd been on scene probably 10 to 15 minutes. We're in the back of the rig. And as I'm talking to the doctor, I realize that one of the things this guy has done since we started giving fluids, he's still unconscious, is he's urinated.
Which probably needed to be done.
Right. So his initial pressure was in the 60s. The top number was in the 60s.
Oh, damn.
I gave him 3 liters of fluid by the time we got to the hospital. It was in the 80s.
Well, I mean, it's better than the 60s.
And he's urinated multiple times. Which, it was my partner's turn to clean up the gurney, so it really did bother me all that much.
Soak it in.
Exactly.
Yeah.
So we took him in there, and they drew labs. They sent it off to the lab, and they had to cut it in the lab, and he was still over 1,500.
You mean they had to cut it?
They had to dilute it because it kept going off the charts.
Oh, wow.
Even in the lab. So they had to dilute it to a certain way so that they could then get it down to a point where they could read it.
Oh, I wonder if they just did hey, dilute it in half, and then that's the CBG that comes out, then double that number, that sort of thing.
So yeah, he was over 1,500. They had him, not only did they give him insulin in his muscle, they actually had an insulin drip going on him.
Oh, wow.
Yeah.
Yeah.
So that is an exceptionally high blood sugar.
Did we ever talk about the fasting blood sugar test?
Not yet. We hadn't gotten there. We got sidetracked by polydipsia, polyuria, polyphagia.
Yeah. That's why people listen, right?
Exactly. For the linear way that our podcast goes.
Easy to follow.
Well, then we jump from those 3 to ketones.
Oh, yeah. I see. That's how that got derailed.
Yes. And then we talk about, a patient whose blood sugar was exceptionally high. So,
well, if you've been listening to the podcast for a while, this is no surprise to you.
Right. So fasting blood sugars. Blood sample? Is that a vampire blood sample?
I was
Vlad
actually
sample.
A Vlad sample.
Blood sample will be taken after an overnight fast. So usually this is like an 8, 10, or 12-hour fasting.
Okay.
And then a fasting blood sugar test, a blood sample will be taken after an overnight fast, usually about an 8, 10, or 12-hour fasting cycle. And it should be less than 100 at that point, or 5.6 millimoles per liter for it to be normal.
Those weird-ass millimoles again.
Right. Fasting blood sugar level from 100 to 125, or 5.6 to 6.9 millimoles per liter, is considered prediabetes. And if it's 126 above, or 7 millimoles per liter above, on 2 separate tests, you have diabetes.
So prediabetes. Prediabetes is...
Are we all pre-diabetic?
Yeah, I think we're all... I think it depends how you look at it. Because I've had this thought before, and I'm just kind of I guess, really, you're pre-anything. I'm pre-death right now.
Mm-hmm.
Actually, Mark, I've been meaning to tell you.
Are you post-death?
No, I hope not. Is this like some weird kind of messed up Sixth Sense sort of thing?
Mm-hmm. I'm actually hearing one voice on this podcast, and my family's really worried about me right now.
But no, prediabetes is one of the things, though, is if you're diagnosed with prediabetes, although this isn't true in all cases, prediabetes can be reversible with diet.
It's basically your last chance before you become diabetic to fix things.
Right. And that's basically what it's going to boil down to is going to be diet and exercise.
Absolutely. And go ahead.
Like I say, you should probably, eat healthy and exercise anyway, diabetic or not.
Don't wait for this point to really start getting on the wagon on that one,
Yeah. Although it is true, though, that some people, even who are diagnosed as diabetic, manage their diabetes successfully with just diet and exercise. Mm-hmm. They don't always need medication.
If you're diagnosed with diabetes, your doctor may also run blood tests to check for autoantibodies that are common in type 1 diabetics.
Sounds like a transformer of some sort.
Mm-hmm.
Autobots.
Exactly. Autoantibodies.
Assemble. Sorry.
They all get together to make one big Voltron.
Yeah.
So these tests help your doctor distinguish between type 1 and type 2 when the diagnosis is uncertain. The presence of ketones, byproducts of the breakdown of fat in your urine, also suggest type 1 rather than type 2. So with type 1, your body is just unable to produce insulin. This is why it's generally brought on in childhood, because your body's has never produced insulin, so you've been running high and they catch it early. Mm-hmm. Type 2 is you've pretty much worn down your pancreas and your body's ability to produce useful insulin. And so this can take decades for it to actually manifest. And this is why with type 2 diabetics, diet and exercise can actually fix it if you catch it early enough. And that's because basically you start running a cleaner engine. And so your body is able to compensate with the healthy lifestyle.
Whenever anyone talks about running a clean engine or a clean running engine, all I can think of is Metallica's Fuel.
Okay.
Yeah, give me fuel, give me fire, give me that which I desire.
Sure.
One of my favorite Metallica songs.
Fascinating podcasting. They are on the edge of their seats right now, I'm telling you.
I also like carrots.
When we get to long walks on the beach and sloppy kisses, then we're going to turn off the podcast.
Well, I'll just kill it now then, because
that's exactly where I am. So, treatments, Chris.
Let's start with insulin, because that's going to be one of the. Well, we just covered diet, and so let's start with insulin, because that's kind of. That's sort of the main treatment, because it's a treatment that can be applied to both type 1 and type 2s, though most commonly it's going to be type 1s. And gestational. And it's really what the body is lacking in the first place. Mm-hmm. It's kind of where the root of the problem is. So insulin is a hormone that's made by the body on the reg.
Yeah, it is.
And it's there's a few types of insulin. There's 4 types of insulin that can be prescribed.
Uh-huh.
So you have short acting, this is just regular insulin. You got rapid acting insulin.
Yeah.
Intermediate. Are you my little John? Is that what this is? Yeah, because whenever I like to go out and freestyle and do my rap battles, I need Mark behind me.
Yeah.
Yeah. But by the way, that doesn't happen.
No.
That does not. Could you imagine me? To anyone there that knows me or has seen my picture on Instagram, by the way, in case there's any question, I am the guy that's wearing the shirt of Mark, who is Mr. Littlejohn right now. Mm-hmm. That's me.
Golden Pipes Frankham is how I like to refer to myself.
Yeah, absolutely. Now try and cut and just, if anyone out there is on Photoshop, I don't know why I'm asking anyone to do this.
You're going to pay for this.
Oh, yeah. Go ahead and superimpose my picture over any scene of 8 Mile. And you'll see just how wrong it is for me to freestyle rap anything whatsoever.
Yeah.
So, anyway, back to insulin. So then you have intermediate acting insulin. It says NPH next to it for like Neil Patrick Harris. Okay, cool. And then you have your long acting insulin. So examples of short acting insulin is going to be Humulin R, Novolin R. Rapid acting insulin examples are going to be Apidra or Humalog or Novolog. So long acting insulins are going to be Lantus, Levemir, and Tresiba are some examples of long-acting insulin.
Did you just lock up there for a second? Or?
No, there's a 4th one. Can't pronounce it. Moving on.
Which one is it?
Tueho Solostar?
Huh.
or Toujeo.
Toujeo?
You're with me on this, right? Though that's hard.
Toujeo Solastar.
Okay, that one.
Sure.
That sounds like a Star Wars character to me. You know, it's like a smuggler. Anyway, so intermediate acting insulins, or it's going to include Novolin N and Humulin N.
Mm-hmm.
So if you choose injections, you're likely going to have a mixture of those insulin types. The reason they have the different types of insulin and the short acting versus the long acting is, like we talked about, blood sugar fluctuates throughout the day. So generally speaking, a lot of patients who are going to be on insulin are going to be taking a long-acting insulin on like a regular schedule, like a dose in the morning, dose in the evening sort of thing. Then you have rapid-acting insulins that can be used prior to meals or just after meals to help control those peaks. Because like Mark was saying, we try and keep, the best thing to do is to keep your blood sugar level at as close to normal as often as possible. Mm-hmm. However, it's not like we slowly graze all day long. So taking a single dose of long-acting insulin in the morning might keep you at a normal level to start out with, but then as you start eating, you're going to get some fluctuations. Well, that's why we have rapid-acting insulins to try and cut those peaks off right at the top. Mm-hmm. So if you do get injections of insulin, because that is how insulin's administered, it's an injection, you'll likely need a mixture of insulin types to use throughout the day and night. Multiple daily injections that include a combination of long-acting insulin combined with a rapid-acting insulin to more closely mimic the body's normal use of insulin. Then do older insulin regimens that only require 1 or 2 shots a day. Regimen of 3 or more insulin injections a day has been shown to improve blood sugar levels. So one of the ways insulin can be delivered is an insulin pump. I think a lot of people have heard about these. Basically what this is, it's about the size of like an old school pager, if that's familiar, maybe a deck of cards.
Right.
That part, that's the pump, and that just kind of clips onto a belt. That's an external piece. Then has a little tube or a line, I guess you could say, that goes out of that, and that actually goes to a little dilly bob doodad that sits on your abdomen. And hey, that's an official term. Don't give me that look. I went to paramedic school. Anyway, that sits on your abdomen, and it's just a little needle that kind of just sits in one spot and has a little protective plastic thingy over the top. And insulin is pumped in throughout the day. You can adjust the pump to give more as a boost for when you're eating. And yeah, so that is the insulin pump.
So Toujeo.
Toujeo, is that how it's pronounced?
I don't know. So I haven't figured that out yet.
Okay.
But I figured out what it is.
Let's call it Solostar.
It's the exact same thing as Lantus.
Okay.
Except that it's a higher concentration.
Oh, interesting.
And so if you have blood sugars that are running higher, they'll prescribe you Toujeo because Lantus generally comes in 100 units per milliliter.
Yeah.
As a reusable injectable pen. And this comes in 300 units per milliliter.
Okay, cool.
So it's 3 times the amount of insulin if your blood sugars are running higher.
Neato. So there's also a wireless pump option. So what it's referring to with the wire. Well, hang on.
Well, the wireless pump option is an insulin pump, but you don't actually have to run it from the pump. You can run it from a wireless. You don't have to take it out from where it is. If you have it like on your belt under a coat, you don't have to take out the insulin pump to adjust anything. You can do it from a wireless remote.
Okay. So like an iPhone app?
I'm assuming it's probably going that way if it hasn't already. But I think that...
and if it hasn't already, we claim it, we patent that, don't steal it.
Exactly. So yeah, the programming is just done with a wireless device that communicates with the pod. So if they haven't already connected it to an app, they probably will. But initially it was actually just another piece so you could, that would talk back and forth so you didn't have to pull it out in public, like if you're at work and stuff like that.
Oh, that's nice.
Yeah.
That's nice. So yeah, and what you'll actually do with these pumps, I mentioned earlier, you can program them to give you more of a dose throughout the day. They can be adjusted. You can actually specifically program in the amount of carbohydrates that you're going to be eating along with your current blood sugar, and it will actually give you an adjusted bolus, a bolus being a dose, essentially.
Well, a bolus is a one-time shot as opposed to like an infusion, which would be over a longer period of time.
Right. And so this will go in and give you that bolus of a medication that's kind of tailor-made to you, which is a really good thing.
It does the math for you.
Which is nice. So they do have a new type of pump. They've given it a fancy name. They've called it the artificial pancreas, but essentially what this is sort of a new and upcoming thing. In 2016, the Food and Drug Administration actually approved the first one of these for use with people in type 1 diabetes, only in patients 14 and older, but it's an internally implanted pump, essentially. And it does what's called closed loop insulin delivery. So the implanted device links to a continuous glucometer that's constantly checking your blood sugar. And it's going to check it about every 5 minutes. And it sends that information to an internally implanted insulin pump. That device then automatically delivers a correct amount of insulin when the monitor indicates that it's needed.
So if you eat something, your blood sugar goes up, it automatically starts putting insulin into your bloodstream, just as if your real pancreas does.
Right, exactly.
Okay.
And so there's actually a few more of these things that are in clinical trials as well. So these are not common. And I don't know about you, maybe you found some information. I wasn't able to find any examples of one currently implanted or in use.
There's actually none being well, I mean, it's been cleared. You said September 2016, it said it had been cleared, right?
Yeah, the FDA cleared it for use. But I have yet to find anything about one actually being utilized.
Like commercially?
Yes, commercially.
That's interesting.
So... because I imagine they had to have some sort of human trials before the FDA said, good to go.
Yeah. So did they clear it completely or they cleared it for next round of testing?
That's what I'm wondering. I'm not 100% sure.
Let's see here. Take control of your diabetes.org. June of last year is when it was first commercially available.
Good.
Like.
Cool.
And it's a hybrid system due to the need to maintain, to manually interact for meals and exercise. So it sounds like that it'll run it all by itself is still a ways off, but they're taking steps to get closer to it. International Diabetes Closed Loop Trial. So, okay.
And that would be an awesome device. That would help a ton of people.
Right. Well, and again, the long-term damage of highly fluctuating blood sugars is just colossally bad.
Yeah, and that's what these devices are going out after. Speaking of that long-term damage, what are some of the long-term damaging effects of diabetes?
Well, I mean, the problem is having all the sugar in your bloodstream. Let's start with the renal system, which is the kidneys, ureters, bladder. Urethra. Not the liver.
The liver's in between the urethra and the bladder, right? That's where that goes.
You know what? I accepted that you were right.
I can stop now?
You can stop.
We're good.
To learn more about this, you can actually listen to the renal system, the renal episode of Medical Stuff, if you want to get more in depth. And I highly recommend it because, damn it, we're great.
Yeah. And that actually was one of our better, that one performed really well. That was popular with you guys.
Better or more sober?
Ooh, I don't remember if I was sober.
So anyway, inside your kidneys, you basically have filters that filter the
blood.
There you go. Thank you, Chris.
Oh, I thought you froze.
No.
I'm like, why am I rescuing?
That was a pop quiz for you.
Gotcha.
And you nailed it. So basically, your blood is filtered in your kidneys. They have these filters. Well, the problem is that the glucose molecules are bigger than the filter.
Yeah.
And this filter is not really something your body can repair on a grand scale.
Yeah, and one of the problems, too, is as these filters get destroyed, like anything else in your body, you can get a scar tissue in the medulla of the kidney, and nothing's going to grow back there. Scar tissue is just scar tissue.
And it reduces the ability of the kidney to do its job.
Yeah.
And so listen to the renal episode. This causes high blood pressure, which can affect your pancreas, which makes diabetes worse. It's all... Strangely enough, the entire body's all interconnected.
Right.
It's weird. Mind-blowing.
It's not just like, they're not like roommates,
Did
you know?
It's like a family. The earth move when I said that? It was earth-shattering.
Yeah. No, I know. Everyone out there's like, what? Even though this isn't live.
Well, yeah. Sporadically. It's not one common voice of saying what, but we can hear it all. You know.
Yeah. We can hear it in the future.
As you do damage to your kidneys, it decreases their ability to process everything else. So if this goes on long enough, the two things that really affect your body, your kidneys, are the diabetes and high blood pressure. And one can cause the other.
Right.
And so once you start having that damage done and it's not being treated or you're not treating it properly, you're actually doubling the chances of doing damage to your kidneys. And if you do enough damage to your kidneys, you then have to start taking medication to make your kidneys work better, or you end up on dialysis, which is 3 days a week, 6 to 8 hours a day, 4 to 8 hours a day, depending on how far along you are, of sitting in a room getting dialysis.
Yeah. And dialysis is, they have these dialysis is
Dialysis.
dialysi. It's like a flock of them.
They have machines that will actually clean your blood for you.
And you get these shunts put in your arteries in your arms.
Right.
And it's just basically like hookup ports for this machine. And getting those shunts is damaging as well. I mean, those shunts, we've gone on many patients where they're bleeding from those shunts, and it's very, very difficult.
Oh, it can be life-threatening.
Oh, yeah. It's very hard to stop.
Well, they have specialized clamps just to hold that shut until it stops bleeding.
Which, and if you want to know what these clamps are like, just go get a pair of vice grips from Lowe's. That's how hardcore. Yeah, exactly. The C-clamp vice grips.
It's a medically made C-clamp.
Right, exactly. So,
and diabetes, the problem with diabetes is, and I heard a nephrologist talk to a patient about this because they're talking about having a baby going on diabetes with the patient's mother. He goes, well, be straight up honest with you. It's really what you want to look at life, quantity or quality. Diabetic patients, diabetic patients also, but dialysis patients, you don't go on dialysis to improve your life. He goes, because you've done the damage. And so you're just going to kind of keep getting sicker as you go.
Yeah.
Will it extend the length of time of your life? Yes. But it doesn't necessarily improve the quality at all, especially long term.
Now, there are conditions where people will be temporarily on dialysis.
Right. That's hugely different.
Yeah. But when you're talking about kidney failure and your kidneys are on their way out, it's very hard to turn around short of a transplant.
Well, I mean, to the point that when triaging a 911 call, if you're a chemotherapy patient, an organ transplant patient, or a dialysis patient, that's automatic lights and sirens regardless of what the call is.
Right. Well, for example...
Go ahead.
Oh, I'm sorry. I didn't mean to cut you off.
No, I mean, because you're so medically unstable at that point. Even if the call is an infected finger.
Right.
Which is a call I had today. We went lights and sirens. The fire department went lights and sirens for an infected finger that had been going on for a month. Why? Because they're a dialysis patient. And dialysis patients are so at baseline medically unstable and prone to infections, obviously, it's been going on for a month, that the assumption is that we need to go lights and sirens just to make sure that they don't go septic before we go. They're not at some point along the lines of sepsis, which...
You can go ahead and learn about sepsis with our sepsis episode.
So that is one of the first problems with the damage to your body. It can also raise your blood pressure, which puts further strain on your heart. And when you have high blood glucose levels, this can contribute to the formation of fatty deposits in the blood vessel walls, which over time can restrict blood flow and increase the risk of atherosclerosis, or hardening of the blood vessel walls, which will lead to what, Chris?
Well, that can actually lead to quite a few things. It can lead to additional hypertension,
right?
High blood pressure.
Which again can go back and affect your kidneys.
Yeah. It makes you more prone to things like aneurysm.
Right.
Or blood vessel ruptures. And it can make you more prone to clot formations, which can lead to stroke and heart attack.
Right.
Or pulmonary embolisms.
It can also decrease blood flow to the point that you get diabetic neuropathy.
And that is a very, very painful experience. And it commonly occurs in patients' legs just because of how far away they are.
Right. And it is very painful to begin with. And when it should scare you is when it stops being painful.
Because that indicates cell death in the area to the point that you're no longer receiving painful signals back to your brain.
And although I don't know how much you see it anymore, it was very common before, in the 80s and 90s, stuff like that. You would find diabetics that wore shoes constantly to protect their feet because they wouldn't know if they got a cut on their foot, even a small cut, that would then become infected and could cause them to go gangrenous, because with diabetes and the high blood sugar, you are much more prone to infection.
Right. In fact, I have a story where we had a
gather round, children. Chris has got a story.
You do that rather well. I think having British parents has helped you with that accent.
Or just being a jackass.
You know what? Jackass is probably more plausible.
Don't bring my parents into this because they've disowned me.
So very, very seldom, whenever we take someone to the emergency room.
I'm just joking, Mom. We really haven't.
Whenever we take someone to the emergency room or we ever have a patient, even if we have problems with other providers, we do our best to maintain professionalism, even when we disagree. This is one of the few times I've seen a doctor just openly yell over the top of a patient at a nurse.
Oh, yeah.
Just openly yell. Yeah, because we had brought this patient and we've been trying to get a line in this guy.
IV line.
Yeah, and trying the whole way.
To learn about IV lines, look at the cardiovascular bloodstream episode.
We have a cardiovascular bloodstream episode?
We're getting ready to record it next.
Oh, yeah. I think I did the prep for that one.
You did.
Yeah.
This is your idea.
Yeah, I know. Should be a good episode. Better than
anyway, Dr. yelling at nurse, tell me.
Anyway, so we're trying to get a line on this guy. We just can't because he has a lot of chronic health problems. His veins are not in the greatest condition due to the fact that this guy receives a ton of IVs due to the number of hospital visits he has. So his veins have scarred
and
up
also
over time.
he's diabetic, I'm assuming.
Yes, he is.
And so his veins are in bad shape anyway because of long-term diabetes.
Right. And his and the blood sugar on our monitor indicated high, which on our monitors is, depending on the monitor, either above 500 or 600. And this was a long time ago, so I think it was the 600 ones that we used to have. Anyway, and this guy does have these big veins in his feet, but I am not going to go for them. Mm-hmm. Because I'm like, nope. That's one of those things where if the hospital determines it's that bad that they want a foot vein, knock yourselves out, I ain't going to be that guy.
Well, and diabetics' feet get so bad, and I'm going to break in on you here, Chris, because...
No, it's fine.
Well, you made me look bad earlier, so...
Fair enough.
No, I know of a person who got fired from an emergency room because he clipped the toenails of a diabetic, a severe diabetic.
Yeah.
They can get infections so easily.
Right. And this patient, so the doctor that yelled at this nurse, she went to go start a vein in his foot. Or I'm sorry. She went to go start an IV in a foot vein. The doctor that yelled at this nurse happened to be this guy's physician. This was one of the few instances where a patient's physician actually did meet us at an ER. And
very rarely happens.
Yeah. And they had just gotten this guy over a foot wound. Just gotten him over a foot wound. And she goes to start an IV in there, and he just yells at her dead in her tracks. What are you doing? Do you have any idea what you're going to do to this patient? Right over the top of the patient. Right me. I kind of looked over, and I was not finished giving a report. I figured it didn't matter at that point, and I'm out.
You pulled a Peter Griffin and just disappeared into the bushes. I was never here.
Yeah, absolutely. I left my I'm like, okay, if anyone has any questions for me, feel free to ask me. Here's my paperwork, and I'm going to be heading out. Goodbye.
Catch up with me later.
Yeah, absolutely. Yeah, just call my supervisor at this point. Don't care.
Which I understand where the physician's coming from, but
can't you just say, don't do that?
Yeah. I mean,
and then move on.
If he's in the ER and this is the patient's private physician, no, she probably doesn't know what kind of work he just did to say get an infection out of his foot because it's the first time she's met him. Yeah. And she's trying to get an IV on a patient. So that really is an unfair standard to put on her.
Absolutely. And that's why we try to maintain professionalism.
Right.
Like that.
Because, I mean, I can understand his frustration, but no reason to be a jackass about it.
Well, and you got to think from the patient's perspective, too. Is now that patient's going to be paranoid about every caregiver that comes in to treat him.
Yeah. So as you destroy the vasculature in your body, primarily your feet, and it can happen in your hands if it gets really bad, so with a diabetic, if they get an infection, their blood sugars tend to go up, which makes it a much more pleasant atmosphere for infections.
Oh, bacteria love sugar. That's fuel to them too.
Right.
So the more sugary it is, the better.
And so your body is not producing the insulin it needs, so you have more free-floating sugar in the bloodstream. So the bacteria is growing at a rampant rate. And this is why these patients, if they don't know that they have a cut in the bottom of their foot and they're not maintaining the inspection daily or some sort of protection, they can actually end up getting gangrene. And it wasn't uncommon, and it still happens. In fact, our patient today with a finger infection had already lost her index finger.
Yeah.
To an infection.
Yeah.
So, I mean, this is, we talk about going code 3 for because she's on dialysis, but there's some legitimacy there too.
Right.
I mean, do we necessarily need to go code 3 to get there? Probably not. But you can understand where the thought process comes from.
Oh, absolutely. And I think you probably more commonly see, I mean, I still see people getting plenty. I see this plenty of times. Toe amputations are very, very common.
Or, foot amputations. They get part of their foot or all of their foot taken off.
Yeah. I think, and even today with all the modern medicine, I had a patient literally the other day who we were actually seeing him because his toe amputations wouldn't stop bleeding. That's actually, we were going to transport him back in, try to get that back under control. But yeah, recently just had 2 toe amputations due to diabetes.
And a lot of people really don't understand. You think, oh, okay, you lost a couple toes. People understand how much you use your toes.
Oh.
For balance and walking, critically important. You have to basically learn how to walk properly again. And you have a hard time with maintaining balance while walking and stopping because your toes actually provide a lot of counterbalance for when your body is moving forward and you try and slow down.
Right.
So, diabetic hyperglycemic hyperosmolar syndrome.
Right.
Go.
So, this occurs in type 2 diabetes. It involves very high blood glucose levels, but no ketones.
Dun, dun, dun.
You might become dehydrated with this condition. You can even lose consciousness. It's shortened to HHS is the abbreviation for it. It's most common in people whose diabetes is undiagnosed. And they haven't been able to control their diabetes because they don't know they have it. This can also cause a heart attack, stroke, even infection.
The high blood glucose levels can cause gastroparesis. So this is when it's hard for your stomach to completely empty. So your body just doesn't process the food out of your stomach. And this can cause blood glucose levels to rise. Yeah. As a result, you may experience nausea, vomiting, bloating, and heartburn.
And gastroparesis is basically, so your stomach does a churning action to help process food.
Like butter?
And help. Yeah, I mean, not too far different. It's just basically a bag of meat that kind of squeezes itself. Right. And gastroparesis, it just lacks an ability to do that very process. Mm-hmm. And so instead of being able to push that bolus of food down to your colon to become poo-poo, it just... or
to be utilized to make energy for your body.
I have kids. Become poo-poo. So
I have a dog and I sometimes go potty, so touche.
Fair enough. Fair enough.
So diabetes can affect your skin, the largest organ of your body. It's funny because you ask people what is the largest organ, and they usually think like heart or lungs.
Or liver.
Right, which is not part of your renal system. I have to say it over and over again to remember it, okay? I'm actually doing this for myself and not for anything else. So,
I think you just did to steal my thunder so I don't give you shit about it.
No. I mean, that's a bonus, don't get me wrong, but, So along with dehydration, your body lacks the moisture to develop or due to high blood sugar and can cause your skin on your feet to dry and crack. So this becomes a problem because that's a source for infections. It's also, conversely, because you think, okay, well, great. I'll just let my feet sweat, or I'll keep them moist, or I'll do something like that.
Moist.
But you can develop in the moist, warm folds. You can these are going to be susceptible to fungal, bacterial, and yeast infections. They tend to develop in between your fingers and toes, in your groin, the corners of your mouth, and the symptoms include redness, blistering, and itchiness. So you can't let them dry out too much, but you can't keep them too wet either. You can use petroleum jelly or gentle creams, but avoid letting these areas become too wet. And you can get high pressure spots under your feet that can lead to calluses. These can become infected and develop into ulcers. And basically an ulceration is where the skin has died and it leaves an open wound. And they are exceptionally difficult to heal. Well, the only way to let it heal is to let it stay open to a certain level and the body to grow the skin back from the inside.
Yeah.
Go ahead.
Which is very difficult to do, especially when it's on something like your foot, which is a vital function of day-to-day life.
Yeah, you can't walk around on it.
Right.
It's also very difficult to do when the patient's diabetic and they have a breeding ground for infections.
Oh, yeah.
And this is left open.
Oh, yeah.
So there are patients that have ulcerations on other parts of their bodies. Common areas are the butt, especially for people that are in wheelchairs, or they used to be called bed sores because if you laid in bed, they didn't know that you're supposed to rotate a person every 2 hours. Mm-hmm. So if you're bed confined for whatever reason, they should either have a bed that does not create pressure points, which are points like if you sleep on a internal spring mattress, you're going to have parts of your body while you lay there that are getting more pressure on them than the rest of your body. Because of that, you get decreased blood flow in that area. And with that, you start getting degradation of the skin cells and the muscle cells.
That'll create an ulcer.
That creates an ulcer. Or people who are in wheelchairs that don't realize that there's a fold of a sheet underneath them that's putting a pressure on one area. Mm-hmm. That's very common.
Yeah. They also have special mattresses that actually have air pockets that alternate.
Mm-hmm.
So like, part of the mattress will be inflated and then it deflates and the other part of the mattress inflates. Not fun fact. Christopher Reeves, who played Superman in one of the original Superman movie series, died of bed sores.
Mm-hmm.
He had an infection.
Fun fact, the gentleman who played it on the TV, who was also named Reeve,
right,
wasn't related to him.
Yeah, no, actually, I was reading about that, and I'm like, oh, that's a coincidence?
Because for years I thought that it was father-son.
Yeah, I believe.
Nope.
I believe, and the first one died as well.
Suicide.
He committed suicide.
So you can also become more prone to boils, folliculitis, which
I think folliculitis is right.
Folliculitis. I don't know. Folliculitis. Infection of your hair follicles. You can get styes or infected toenails, and this is one of the reasons why clipping the diabetic's toenail was such a bad idea. Now, the guy who got fired, okay, yes, that was the thing that got him fired.
There's more than that,
though. This wasn't like a, what? This was, okay, we've talked.
Right.
This is just the thing that gets you fired.
That is one of the things about the medical profession, is because of what we do. Here's the thing. Human beings aren't perfect. It does not matter what profession you have.
Right.
You're going to mess it up sooner or later.
But there's a big difference between treating patients and making widgets.
Right, exactly. And so it's one of those things where it's like, yes, we are held to a very high standard, but at the same time, even when we make mistakes, there is a process to coach us to do better next time.
Hopefully.
It's kind of up to us to absorb that process.
Well, there's a reason why they call it practicing medicine.
Yeah. Right.
Because, if you're going to go to, say, a hospital, the hospitals that do well are the ones with the doctors that realize they don't know everything.
Yeah.
That know when to step back and get a second opinion, call in a specialist.
Call paramedics.
Yeah, that's what they do. So, but no, I mean, that's what you should be looking at, is whether these people think they know it all or they understand how little they don't know. My personal physician, one of the reasons I like him is he knows those 3 words that some doctors just don't know.
I don't know.
I'm going to go research that, or I'm going to talk to somebody who does know.
Yeah.
Because you can't know everything in medicine.
No, you can't.
You cannot. So,
I mean, unless you're Mark Frankham or Chris Finks.
Right. So, I think that's about everything I have. How about you, Chris?
I'm pretty well set. Obviously, diabetes is a very complex topic.
Yes.
I mean, we could probably do a second episode on it and be just fine.
Right.
But no, that just about covers. Oh, one thing. So I did want to touch a little bit on the reason why Mark and I run on so many diabetics with low blood sugar. Never really dug in depth to that. So diabetes causes high blood sugar. Mm-hmm. A lot of diabetic patients take insulin. Insulin drives your sugar lower. The problem is when patients have difficulty managing their diabetes, or if their diabetes changes, because that does happen. Their disease process changes and that kind of fluctuates their blood sugar levels a little bit more. But they will take insulin to lower their blood sugar, and if they don't eat, sometimes their blood sugar will then drop too low. That's really not an effect of diabetes itself. That's an effect of the medication that they take. And so we commonly get called to that call. And our solution is simple. We start an IV. We put sugar in the IV. We talked about the different mixes for that, but it's really simple. It's just
it's glucose.
Yeah. Well, it's dextrose.
Yeah.
So it's a mix of dextrose, and depending on where you are, it's going to be either dextrose 50%, or we do a 10% mix where we're at. And oftentimes, once we do that, we don't transport the patients.
Right.
We bring up the sugar. We make sure they get some food in them, because the fuel that we're giving them is going to burn quick. Mm-hmm. And we give them some longer lasting fuel, just some good food.
Peanut butter sandwich.
Oh yeah.
Something that's going to give them a long release of sugars over time.
Yeah. And then we leave, and that's it.
Mm-hmm. Hopefully we don't get called back.
Right, which we do.
Well, okay, with these patients, we want to make sure there's somebody there with them because they're going to want to keep an eye on their blood sugar. And the one thing we don't want to happen is we leave, the patient gets left by themselves and they're back in the same position again.
Right.
So, anything else?
No, I'm set.
Okay. So we are Medical Stuff. We are on Twitter at Medside Stuff. We're on Instagram at Medical Stuff 52. We're also on Facebook at Medical Stuff. We have an email address, which is?
It's going to be medsidestuff@yahoo.com.
MEDSIDESTUFF at yahoo.com.
Oh, Mark can spell.
Better than you. And you can find us on your favorite podcast catcher. We're on iTunes, Google Play, Stitcher,
iHeartRadio,
Spotify, or you can go to our medical stuff at good Lord, medicalstuff.podiant.co.
Yeah.
So please drop us an email if you have any questions, comments, or concerns. If you have anything you want to rail against what we've said, definitely on Twitter. That's the perfect platform for it.
Or just keep it to yourself.
But we'd love to hear from you. Have a good evening and
Toast.